Hello, and welcome to The Explainer. In the next few minutes, we're going to dive deep into autism spectrum disorder. We'll unpack what it is, what it can feel like, and what the science actually tells us. So let's get right into it.
So what does it really mean to be on the autism spectrum? It's a phrase we hear all the time, right? But what's the actual lived experience behind that label? To figure that out, we have to start with the basics. So, to really build our understanding from the ground up, we're going to start with the core definition. Think of this as the bedrock for everything else we're about to cover. Now, the key term here is neurodevelopmental. It sounds a little technical, but it tells us something absolutely crucial. It means autism isn't a choice or a mental illness. It's a fundamental difference in how the brain is wired, right from the ground up. And that wiring shapes how a person experiences, well, every single part of the world. Okay, so if the brain is wired differently, what does that actually look like in day-to-day life? Let's explore the core features of ASD, not as a list of problems, but as a really unique framework for seeing and interacting with the world.
A central feature of ASD revolves around social communication. Now, this can mean a whole range of things, from finding eye contact really difficult to having less of that back-and-forth play with peers. But one of the most foundational challenges is a concept called joint attention.
You know, joint attention is this vital social skill that most of us learn as infants without even realizing it. Just picture a little kid pointing at an airplane in the sky, then looking back at their parent. They're not just looking to see the plane, they're looking to share the experience of seeing it. It's that simple, nonverbal act of saying, "Hey, look at that with me." Yeah, this shared spotlight idea is just a perfect way to think about it. It's all about two minds focusing on the same thing together at the same time. And when that skill is a challenge, you can imagine how it would have this huge ripple effect on pretty much all other aspects of social learning. When it comes to language, the spectrum is incredibly wide. Some autistic individuals might be nonverbal, while others have these huge, amazing vocabularies. The difference is often in how that language gets used. It might be much more literal, or include these really passionate, repetitive monologues on a favorite topic. Or you might see something called echolalia, which is repeating words or phrases they've heard. This need for predictability, it's a really powerful driver of behavior in ASD. Routines and sameness can create a sense of safety and calm in a world that might feel, pretty chaotic. And while those interests can be very narrow, they can also be a source of incredible joy, expertise, and deep, deep focus. To try and understand the autistic sensory experience, imagine this. You're listening to every single instrument in an orchestra, but they're all playing a different song at full volume all at once. For a lot of neurotypical people, the brain just automatically filters out the background noise. But for some autistic people, everything comes through. The lights, the sounds, the touch. It can lead to a state of complete sensory overwhelm. Okay, this brings us to a really critical area. With a topic like ASD, there's just so much information out there and, frankly, a lot of misinformation. So it is absolutely vital to separate the scientific facts from the fiction.
Let's be crystal clear about this. Research has definitely linked an increased risk of ASD to certain genetic and perinatal factors. But what's just as important is what the science has completely ruled out. Decades of research have shown conclusively that there is no link between the MMR vaccine and autism. That idea has been thoroughly and completely debunked. Getting the right diagnosis is so important, mainly because some features of ASD can look a lot like other conditions. Understanding these key differences is really the first step to getting the right kind of support. This is a really important distinction to make. A behavior like headbanging in an autistic child, which is called self-injurious behavior, or SIB, is often not about emotional distress in the way we usually think of self-harm. Instead, it can actually be an attempt to communicate physical pain or to regulate a totally overwhelming sensory system. The motivation behind it is fundamentally different. The crucial word here is context. A child with selective mutism might be a total chatterbox at home, but completely unable to speak at school. In ASD, on the other hand, the social and communication difficulties are what we call pervasive, which just means they're present across all situations, not just specific ones. And these careful distinctions apply to other conditions too. With something like OD, you don't typically see that same insistence on rigid routines. With ADHD, the core challenge is about attention, not primarily about social interaction. And even with OCD, where you do see repetitive behaviors, it takes a really skilled clinician to understand the different motivations behind them. Okay, so finally, let's talk about what happens after a diagnosis. This last section is all about the different pathways to effective management and, most importantly, support. This is maybe the most important takeaway when it comes to treatment. There is no pill that cures autism because, well, autism isn't a disease to be cured in the first place. Instead, management is all about providing support, building skills, and treating any associative conditions. This whole process just shows that a good support plan is always a team effort. It's about bringing everyone to the table, family, teachers, therapists, to create a holistic plan that uses positive strategies to help the individual thrive on their own terms. And all of this information kind of leads us to a much bigger question, because understanding the clinical side of ASD, that's really just the start. The real work is in applying that knowledge. It pushes us to think beyond diagnosis and ask ourselves, how can we all help build environments, at school, at work, in our communities, that truly support every single way of thinking and being? Thanks for joining this explainer.